Chronic disease is a large part of life in today's society, and many people have had, have, or know someone who has suffered from a chronic disease. Chronic disease is considered to be something that you have for a long period of time, a year or more. It needs constant ongoing medical care, and it can also affect your daily routine. Health informatics Health informatics are a term describing the acquiring, placement, and storage of, as well as retrieving and using that healthcare information to better discuss among all the patient's healthcare providers to better provide for that patient. This can be done. Healthcare informatics uses data. The data can be used to determine if a certain disease is more potent in one area than another, to determine what medications might be best for patients or symptoms, overall treatments for certain diseases. Of course, with health informatics also comes ethical issues. Ethical issues reside in almost everything. And with chronic illness, there is some issues. Not everybody feels that somebody who gets sick due to diabetes or weight-related issues should have the same care or treatment or be provided with better coverage, or be provided with coverage for these treatments because they caused their disease. They encouraged it. They could have watched their diet. They could have exercised. They could have not take sugar. But regardless of why somebody got sick, we shouldn't consider that when treating them. Everybody deserves health care for their illnesses or diseases. There have been policies and programs put into place to help with this. The Strength Known Incentive Program for the Supplemental Nutritional Assistance Program, SNAP, is working on providing more incentives towards people who use SNAP for them to purchase healthier foods. So if you purchase fresh vegetables, you can get double the amount for a single price to hopefully encourage them and off-put them into buying the processed foods, the stuff that isn't as good for you. This will help, hopefully, provide more of a healthier living and healthier lifestyle for those who use those programs. It's a start. When it comes to the way the delivery system is in healthcare, nowadays it's education. Education is provided to all patients on their condition and on conditions they can prevent. For instance, if somebody has diabetes, they're told watch your blood sugar, watch your intake of carbohydrates, your starches, and they can monitor their own blood sugar at home. By monitoring your own blood sugar at home, you could see, okay, I'm at 68, I'm a little on the low side, but I didn't eat lunch yet, so okay. If it's at like 300, I need to go to the doctor, something's not right, I need to take medication. So you actually limit the amount of times you go into an emergency room or a care facility without needing it. The more you know. In today's day and age, EMRs help a lot with collecting all the data from all over, from all the different doctors you see, and putting it into one system. Electronic medical records are used in all facilities and can be shared between facilities, making it a lot easier to receive care from multiple providers, like a specialist or a primary care physician. Other forms of data that can help and other tools that are used are CAT scans, MRIs, and other forms of data collection for healthcare. Those can be put into a system, analyzed, debated, and determine maybe what's the best way to go about it. If there's a sign on your left side and not your right side, it might mean something different. And with these evaluation and the tools they use, they can determine what would be the best course of action for your health. Prevention of chronic disease and the management of care is possible for a lot of those who suffer from chronic disease. Diabetes can be managed. It can be managed by taking your pills, taking treatments, losing weight, being on a diet, a low carb, low sugar diet, high protein, high fat, something to maybe you lose a little weight, you won't be on the pills no more. You won't need diabetes medication, but you should always monitor your blood sugar regardless because it can come back. Not all diseases are like that, but some are. They're preventable. The more you know, the better you are when it comes to healthcare and chronic diseases. The increase of access to medical care and medical records and care, it plays a huge role. Over the years, more and more laws and programs have been developed to better advance the health and care for those with chronic diseases, as well as for those who will develop them in the future. Please take with you this information to better care for those we assist.